members of the press and fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
The month of March in 2020 was the beginning of a 2-year journey that left the country broken and economically constrained as the first case of the COVID-19 pandemic was reported in the country. According to the World Health Organization, 5,689 people died from the pandemic in the country. The onset of the pandemic called for instant measures to curb the spread of the virus as well as manage the already existing cases. The national government dedicated a COVID-19 kitty for all the 47 counties to help manage the health crisis that was ripping through the country. Nakuru County was fairly affected by the virus as the national government allocated a lump sum of 602 million to the fourth city in the country, according to a report from the Office of the Auditor General. The funds allocated have brought immense changes. Nakuru Teaching and Referral Hospital, a level 5 hospital, is a go-to hospital for the residents of 8 counties in the Rift Valley region. The hardware and software facilities implemented about 2 years ago have become a game changer for the health sector. Oxygen supply was crucial in saving the lives of COVID-19 victims who suffered from shortness of breath. Nakuru Level 5 Hospital adapted a state-of-the-art oxygen plant, the largest of its kind, not just locally but in sub-Saharan Africa. Carl Kangethe, a biometric engineer at the oxygen facility, notes that the plant has been a game changer.
The children, the neonates, the adults with respiratory distresses, for now they are more safe. Oxygen is plenty, it's flowing to each and every point. So it's a total great change in this facility.
This oxygen plant produces 2,000 liters of oxygen per minute, enough to fully supply the level 5 hospital.
We can rely on oxygen throughout. It can feed the whole facility with no deficit, with no ration, because it's readily available.
The oxygen plant, which is located near the Cancer Center and Margaret Kenyatta Mother and Baby Wing, has seen a reduction in the number of deaths recorded from cancer patients and maternal complications. The hospital, which is presently oxygen self-sufficient, intends to supply other hospitals commercially in the near future.
It passes through as ejaculates. We have not 2 layers now. That are gases and oxygen is short. So as it comes to fill, the instant to be filled, it pushes down the other gases.
A further survey in the hospital revealed that hygiene is closely observed. In 2021, the hospital further implemented a modern waste management system by investing in microwave and shredder equipment. Waste collected from the wards goes through a series of stages by first separating health waste from food waste, plastics and metallic equipment. The waste then goes through this equipment where it is shredded into small pieces and then sterilized before disposal to the local Gioto dam site. Dr. Joseph Ndongo, the deputy chief nurse at the Nakuru Level 5 hospital, notes that the equipment was adopted to reduce the spread of COVID-19 via waste, but has continued to serve the hospital and the community at large. The pandemic was an eye-opener to the health sector, prompting a change of attitude and behavior. Nakuru PGH has since adopted a surveillance system to monitor new strains of diseases. Jonathan Olinda, the surveillance officer, has this to say.
We are going around to ensure the safety of the society by reviewing the presentations of our patients. At the back of our mind, we want to point out if there are risks of increased transmissions, severity. It's like a form of preparing And this has also helped even the healthcare workers to increase awareness and uptake of vaccines, like the influenza vaccines. Now healthcare workers are taking vaccines. And they also increased uptake of hepatitis B vaccine among the healthcare workers. And even the healthcare workers' behavior as regards infection prevention and control has actually increased.
The changes at the facility are a clear indicator that the effects of COVID-19 are still felt at the hospital. That notwithstanding, a report from the Office of the Auditor General has brought to light concerns over the misappropriation of COVID-19 funds. The Center for Enhancing Democracy and Good Governance, a grassroots civil society organization founded in 1995, says there was no proper framework for expenditure after examining the Auditor General's report.
Of the total 602, only 312 million was spent. There is no proper justification that was given by the county government of Nakuru as to why the entire amount was not spent, considering the impact that COVID had on people's health, people's livelihoods. It becomes more interesting when the Auditor General establishes that all these 312 million was not spent lawfully and effectively. And in fact, the entire amount was queried. And the big question was lack of supporting documents.
The Center for Enhancing Democracy further questions the role of the then County Assembly, saying that MCAs did not provide proper oversight due to conflicts of interest.
They wanted to be the ones distributing food. They wanted to be the one distributing masks and sanitizers. They wanted to be seen to have helped their voters. You can't be the one in carrying expenditure, then be able to question how that expenditure happened.
Nakuru County presented an expenditure of 312 million, according to a report by the Office of the Auditor General, with a whopping 14.9 million Kenyan shillings spent on blankets, bags, umbrellas and reflectors. Only 1.2 million Kenyan shillings was spent on water projects at a time when water supply was a crucial mitigation factor. The Auditor General's report reveals missing links in COVID-19 funds expenditure. For instance, the report shows that 6 million Kenyan shillings was spent on a 6-day MCA's training exercise and overpayment of frontline health workers to a tune of 2.9 million. The absence of approved work plans, budgets or training plans is also raising eyebrows. Mombi Wambogo, K24 TV, Nakuru County.